Okay, Catherine, so now what we're gonna do is I'm gonna inspect your neck and we're gonna look at, I'm gonna check the nodes on your neck, okay? So I would look at you first, I would make sure that everything is straight and midline, and it is, and can I have you swallow for me? Okay, very good. So everything stays, there's no deviation, and everything looks symmetrical. And what I'm gonna do is I'm now gonna just kind of feel for your nodes. So I would do it on both sides, and just kind of, these are your preauricle. And they're right in front of your ears and your nodes. And then I'm gonna do post-auricle. Okay, I'm gonna do tonsillar. And then I'm gonna do submandible. Okay, and then I'm gonna do submental. Okay, and everything feels good, you don't have any swelling or you don't have any tenderness when I do that? Okay, and so what I'm gonna do now is I'm just gonna go along and I'm gonna do your interior superficial nodes. I'm going right down the side of your neck. And then your superior. I'm gonna go into your deep cervical chain, which is right in here. Okay, and I would do this on both sides, of course, I'm just doing it on one side right now. Okay, and just since I'm on this side, I'm gonna have you put your head down and gonna turn it in. And I'm just gonna kind of feel for your clavicle, your infraclavicle, which is lower, and then your upper supraclavicle. And I don't feel any nodes, I don't feel any lesions or anything like that, or masses. So that's good. Excellent. Okay, and so what I'm gonna do is I'm gonna walk behind Catherine right now. And while I'm back here, Catherine, I'm gonna actually check your occipital nodes, which are back here. Okay, and they're right in the occipital region. Okay, right behind your head. Okay, very good. And I don't feel anything, so that's good. All right, so now what I'm gonna do, Catherine, is I'm just gonna check your spine, and I'm gonna start checking, just you have like, just to look at your spine, and your shoulders are equal, and your posture is good. And I notice that your spine is straight, and I'm just gonna kind of palpate around, and I'm just gonna feel, and just let me know if you have any tenderness. No tenderness when I do that? No? Okay, and before I go on, I just want to actually also check your thyroid since I'm here. So what I'm going to have you do is I'm just checking to see if there's any masses or any nodes on or any change in your thyroid. So I'm going to have you put your head down and I'm going to have you turn into my hand. And I'm just going to slowly palpate around it. And I can feel it, but I don't feel any masses or any swelling. And then I'm going to have you turn into this hand too. And same thing, kind of like putting it, yeah, right into it. Perfect. Okay, and also I'm going to have you do range of motion on your head while I'm here. So I'm going to have you put your head forward, down, chin down, and then I'm going to have you bring your chin all the way up and stick your head back. Excellent. And then can you go side to side with your neck? Like, no, you can put your head back up straight, and then go side to side. Your ear down, and then your ear, yep, awesome. So now I'm going to have you just press on my hand. Press, press, press. Excellent. So you have great muscle in your neck. So that's +5 muscle. So I'm going to have you actually take your shoulders now, and I want you to lift your shoulders up for me and press on them and lift them up. Yeah, you're strong. Very good. +5 muscle strength in your shoulders. All right, so now, Catherine, what I'm going to do is I'm going to just listen to your lungs. And so first what I'm going to do is I'm going to put my hands at the bottom around the 10th rib, and I'm going to kind of wrap it around here. I'm going to have you take a deep breath in and exhale. So you have equal symmetry with inhalation and exhalation, and it was nice and big, so that's very good. All right, so now what I'm going to do is I'm going to check for tactile feminist. So First of all, I'm gonna do this test, and when I'm gonna put my hands, the palm of your hands, whenever you feel me press on them, I just want you to say the number 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, very good. So what I'm feeling for is vibrations, and so that's very good. So now what I'm gonna do is have you give yourself a nice bear hug if you can, put your arms around and give yourself a nice hug. All right, and so what I'm checking for is just the resonance, and I'm just gonna kinda go around and I'm just gonna palpate. Okay, so it's very good. So, so resonance throughout, which is normal, and now I'm gonna do a diaphragmatic excursion. So what I'm gonna have you do is I'm gonna have you take a deep breath if you can. Take a nice deep breath, and I'm gonna have you hold it. In, okay, hold. Okay, so I'm gonna go there, and you can exhale. Good job. Okay, and now what I'm gonna have you do is I'm gonna have you take a deep breath in, and I'm gonna have you hold for the inhale, okay? So I'm gonna have you do that again. Go ahead, inhale in. Okay, exhale. Okay, so that, let me test that. I'm gonna measure it. And so when I measure this, okay, sorry. All right. So it pretty much says it's about 5.5 centimeters, so that's pretty normal, okay? So, healthy young lady. All right, and then now, what I'm gonna do is I'm just gonna check you for CVA tenderness before I auscultate your lungs. So then I'm gonna kinda go down towards your kidneys, and when I go down here, I'm just gonna kinda give a little bit of a tap on your kidney and tell me if it hurts. Does that hurt? And how about here? No? Okay, so you would have pain if you had any issues down there. All right, and now what I'm gonna do is I'm going to auscultate your lungs, and I'm gonna start up here at the ABC. So you start up high, and I'm gonna have you open your mouth and just take a couple of deep breaths in and out. And exhale. Good, again. Are you getting lightheaded, or you're okay? Okay, you can go slow. Just a couple more. Just want to get your bases. On this side. And on this side. Okay, so that sounds great. So you don't really have any adventitious breath sounds. Everything seems clear throughout. You don't have any difficulty breathing, and you don't look like you're in any kind of distress. Have you had any colds or anything in the past couple of days? You've been okay? Not coughing anything up? Okay, excellent. All right, and then, so what I'm gonna do now is I'm going to test you. I just wanna go over the breast exam with you. And have you ever given yourself an own breast exam? So you're 15, and most likely, girls who are 15, they're not usually doing breast exams, but it's always good to learn how to do it, and when you start going to the doctor, they'll start doing it for you. I will not give you a breast exam on the video, but I'm gonna explain it to you and we'll go through how you would have it done. Most of the times when you're gonna go have a breast exam, or do a breast exam, you do not want, you wanna wait at least a week after your period, cause that's when your breasts are sore, and sometimes you do get cysts during that time, so don't do it then. And if I was to do it for you, I would tell you, you should stand in a mirror, and you always put your hands on your hips and stand like this. So you want to be able to, see what your breast looks like, make sure sometimes one is bigger than other. They may be that's how you may be born with it. If it looks different to you, that's something that you would want to address. You would wanna put your hands on your hips, and you wanna see the muscles, so that's why you would do that. And you would look to see if you had any dimpling, or if you had any bulging, or anything like that. You'd also wanna look at your nipples and the size of the nipples and make sure everything looks okay there. If there's any redness or any chapping. So then what I would do is I would have you put your hand over your head, and you put it behind your head. And then what I would do is with my 3 fingers, I would start over here on the left side, and I would kind of go in a circular motion. I would go right around your breast, and I would just do it continuously around until I get to the nipple. And then you would kind of squeeze and make sure there's no discharge from the nipple. And I would of course be looking for any kind of mass or anything. You want to go as far as you can under here too, because that's where you can get some lesions under there. And then after I would do that, then I would want to check your axillary nodes. And so I'm going to actually do that right now. So what I do is I rest your arm. So what I do is I stick my hand under your axillary area, and this is your central node. So I'd go under there and I would palpate that. And then I'm going to go down here, and this is your lateral node. So I'd palpate that. Okay. And then I would go on to the inside, and I would palpate the inside and make sure that there's nothing in there. And then I would palpate your mammary nodes, which is right around here. So I would want to check to make sure there's anything there. And last, I would want to go back and then over by your scapula in the back, and I would check behind and see if those nodes were okay. Okay? Now, do you have any questions or anything about breast exams? You're okay? All right, and then last I'm gonna, now I'm gonna check, I already checked all your notes. Okay, and next I'm gonna I'm gonna listen to your heart. So we can stop for 1 minute and then I'll have her lay down.